So, if I understand it correctly, are there other things we could do to make our society more contraceptive smart and more contraceptive effective?
In relation to sex education, are there anecdotally, you mentioned the fact the myths out there about the pill, for example. Are there other areas as well that you, and I suppose it's an anecdotal question and just from maybe your experience or talking to peers in this area?
I think it's looking towards a real solution, so I think it's a really important question. The issues we're discussing, the genesis of them is complex. And so it's a complex problem, so the solution is going to be complex. No one size is going to fit everybody, and there is no single solution. But if we had a magic wand, I think what we would be looking at is we actually have been effective at certain parts of public health messaging, and we need to do more of it. The work that's been done by the Crisis Pregnancy Agency, for example, has been extremely helpful to us in practice, but there needs to be more of it and expressed through different modalities. So there's a piece in education that needs to be built up and developed. We deal with parents of girls and boys and adolescent children frequently, and some of them are well able to articulate these issues within their households. We would understand, but we would, I think the impression is that a lot of them aren't. Arguably, perhaps a majority of them aren't. I think our educators certainly could be enfranchised and directed and trained to do more in this area of care, so that we would be able to approach a situation where these topics, which I think are still difficult for many of us to discuss, could become easier to discuss. A key set of values and expectations could be built around service provision. That a truly multidisciplinary approach could be taken, that the practice nurse could be every bit as important or as useful as a general practitioner, as the community pharmacist in this area of care, as the public health nurse. That at the moment bits of it are still hived off and broken up in a way that's actually not helpful for the public. I think you might be approaching a situation where we have a society that is contraceptive smart.
And there are